Thank you so much, Dr. John Neustadt, for coming on Wellness Your Way. I'm excited to have you here.
Me too. Thank you.
Of course. Well, I've read your very impressive formal bio to our audience, but please just tell us in your own words a little bit about you and how you ended up here.
Well, how I ended up here is, I think, as much a surprise to me as it is to the people who knew me 20 years ago. I never thought I'd be specializing in bone health and osteoporosis, but I was in clinical practice and I started getting patients with osteoporosis. So I was doing what I thought was the best job that I could do. I was working with them from an integrative medicine approach. I was counseling them on diet and lifestyle and exercise and dietary supplements. And some were taking medication, some were not. And their bone density tests were going up in general. And so I was happy. My mother-in-law has osteoporosis. She's in her 90s now. She's had osteoporosis back then as well. And I was working with her on an integrative approach, and she had a physician as well who was working with her on medications, and she was taking Fosamax. And with all of these things, her bone density was going up. And so she was happy. I was happy. Her doctor was happy. And then she tripped on a throw rug. She caught her foot on a throw rug at her house, fell, and broke her hip. And I thought to myself, what is wrong with this picture? Her bone density was going up, and yet she still broke a bone. And that's when I dove into the research to really understand this issue of bone health. And what I discovered is that the almost myopic or sole focus on improving that number on the test, that bone density test result, is too narrow. It's missing the larger picture. It's making people think that they are protected when in fact they're not. What we know about bone density tests and osteoporosis is that in women with osteoporosis, they only predict 44% of women who will break a bone and only 21% of men. And that's been known since 2008. So it's not new information. And yet patients and moreover, doctors are just treating that number on the test. The most dangerous thing with osteoporosis is breaking a bone. If you are a woman with osteoporosis and you fracture a hip, there's up to a 36% chance that you're going to be dead within a year. And for those women who survive, half of them never regain their pre-fracture level of mobility and pain-free lifestyle that they had before. And in fact, about 20% of them require ongoing care. If you're a woman 50 years old or older, you actually have a greater risk of getting an osteoporosis fracture than you do of getting breast cancer.
Wow.
And there's no osteoporosis. People aren't having these big ribbon campaigns. It's sort of this silent disease that starts to creep in as people, primarily as they get older. There are no symptoms associated with it until one day you break a bone. That's oftentimes the first symptom people have because they're not getting screened, despite the fact of the limitations of the bone density test. It is important to use it as one variable in a larger picture for looking at improving bone health, maintaining strong bones, and reducing fracture risk.
Very interesting. So, if I'm understanding you correctly, there are some cases like your mother-in-law where the scores could be going up, looking good, and there's still a problem. And there are many other cases, you mentioned around that 40% number of people who have a fracture, I believe, have already been diagnosed with osteoporosis or something like that, meaning that people whose scores are indicative of not good health. Basically, what I'm trying to say is it goes both ways. People can look healthy and not be, and people can look unhealthy and actually be healthy. Am I understanding it correctly, or can you correct me?
So what the bottom line issue, the fundamental issue here is that people are treating a number on a test, which has a very, very poor association with the actual thing we're trying to prevent, which are fractures. And the research shows, in the North American Menopause Society, their old position statement on osteoporosis correctly concluded that fracture risk depends on factors largely other than bone density. So what I'm saying is, by narrowly focusing only on bone density, they're missing the larger picture, and
Got
people
it.
are dangerously unprotected.
There we go. That makes a lot of sense. It's not perfectly correlated with your risk of health, and largely we're unprotected. Is this problem also getting worse, or is it just our awareness of the problem that's getting worse?
Great question. It is getting worse because the population is aging. Osteoporosis is primarily a condition that affects people as they get older, and primarily women. About 80% of cases are in women. And now the globally, there are more people over the age of 65 than younger than 5 years old. And in the US, that trend is also starting to occur here. You have all these baby boomers that are passing that 65-year-old threshold, which gets you into even a higher risk category. But once a woman goes through menopause and for the 10 years after, that's when you have the fastest rate of bone loss. And so that's when we see a lot of cases happening. But they're also starting to occur younger because there are a lot of medications that damage bone and create osteoporosis, like antidepressant medications and acid blocking medications that people are on, that also damage bone and increase fracture risk. So it is an increasing problem, so much so that now globally, osteoporosis is second only to cardiovascular disease as a global health issue.
Wow. Really important. And I read a great article that you wrote on medication induced osteoporosis. This is some of what you're touching on here, some of these medications that are really increasing in usage are causing, or at least exacerbating, the problem here. Can you go a little deeper on this medication induced osteoporosis?
Yes, absolutely. And I think one of the big things to understand is most doctors aren't aware of it. It's a blind spot for many doctors. They're prescribing these medications not knowing the damaging effects on bone. So it's imperative that people educate themselves on this and check what they're taking, and not just ask their doctor, but talk to their pharmacist as well. That's why I dedicated a whole chapter in my book to this topic. It's called, I think it's called Check Your Medicine Cabinet, or What's in Your Medicine Cabinet, something like that. Look at what you're taking, because some of the most common medications, like any of the antidepressants that increase serotonin, like Prozac, Wellbutrin, those damage bone and increase the risk for osteoporosis and fracture, so much so that the research has concluded that I believe it's for every 14 women taking, or people taking, an SSRI medication, will expect one to break a bone.
Wow.
And most doctors aren't aware of that. In fact, a study was done looking at patients who entered the hospital when they had a fracture. They had a fracture, a hip fracture. They entered the hospital, and so they looked at the medications they were taking for the 3 months prior, and then the medications they were taking after they left the hospital. And what they found is that over 75% of those patients were taking medications that increased the risk for osteoporosis,
Mm.
or increase the risk for fractures, or increase the risk for falling. And in fact, 95% of fractures occur because somebody falls. So that's an important thing to look at. It's more predictive than bone density. And what they found, when the patients left the hospital, the doctors didn't take them off those medications, or if they did, they put them on a different medication that also damaged bone and increased fracture risk. So there's no net benefit. So some of those medications we know that damage bone are prednisone, the glucocorticoid medications, acid blocking medications like the proton pump inhibitors, Prilosec, the little purple pill that the first warning letter from the FDA went out in 2010 for that
Mm.
medicine. And yet it's still on the market. It's over the counter now. People are taking it for years. And it's associated with a 60% increase in hip fracture risk when people take it 4 years continuously. And it was
Wow.
never intended by the FDA to be continued that long, yet people are taking it for years thinking it's safe. Other medications, aromatase inhibitors for breast cancer, tamoxifen for breast cancer in premenopausal women, other medications, androgen deprivation therapy for prostate cancer, phenytoin for seizure disorders. The list just goes on and on and on.
Wow. And that list is in your book?
Yes.
That's great. We will definitely be touching on the book as we go through this interview. And of course, for listeners who are already eager to get it, we'll include that link in the show notes. So we're understanding a little bit about why this is perpetuating. We're understanding we don't really have one specific test, or at least it's not the bone mineral density test that we put all our eggs in that basket. How do we test for this? Is there a better way?
It's a great question, and there's really not. Unfortunately, there's not a better way. There are other tests that are out there. There's a CT test, there's ultrasounds, there are other tests. All of them are the bone density test is considered the gold standard. So they're all compared against that. None of them have been shown to be superior, perhaps equal to, but not superior at predicting fractures. There are no great blood tests either. What we do know is this is a complex condition. It is a chronic condition. And we know that there are things that people can do. Yes, you can do some testing. It can give you some information. But if you're looking for that one or two tests and you're just going to change those numbers on the test and suddenly you're magically protected, that's just not how the body works. And that's not how it works, especially with respect to bone health and osteoporosis.
Really interesting. I think it's so tempting to want to simplify. We want to look at one number, whether it's the total cholesterol, which our listeners will know I don't really think that tells us the whole picture, or whatever it is. We want one thing. And I agree with you in many aspects that it doesn't work that way. So interesting to know that the same is true for bones. I wonder if inflammation is something that you think about when you talk about bone health, and if so, how that's related to bone health.
Absolutely. So chronic inflammation and chronic inflammatory disorders are associated and are known to cause osteoporosis, exacerbate osteoporosis, and increase fracture risk. So we see that in autoimmune diseases. We see that in irritable bowel disease like ulcerative colitis and Crohn's disease. We see that across the board when there's chronic inflammation. And so, yes, that is a problem that hopefully can be addressed by, if you have an underlying disease, trying to find the underlying cause and treating it, hopefully. But also just in terms of diet and lifestyle, there are things that we can control. There's anti-inflammatory foods, an anti-inflammatory diet. There's an anti-inflammatory lifestyle. So there are things that people can do as well. But yes, inflammation, especially in our society where we're following primarily what's considered a Western or standard American diet, is pro-inflammatory. It's high in processed foods. It's high in omega-6 fatty acids, pro-inflammatory omega-6 fatty acids. It's low in anti-inflammatory omega-3 fatty acids, low in fruits and vegetables. So the standard American diet promotes inflammation. If there's any one thing anybody to change for their long-term health, I believe they should start with diet.
Amazing. So you're giving us some great tips already. It's not the standard American diet. It is something more rich in fruits and vegetables, which are anti-inflammatory. It is shifting to that omega-3 and not omega-6, which most of us are too high in. Can you talk to us a little bit more about diet and lifestyle factors that would help us control inflammation and thus bone health?
The research is very clear. The Mediterranean dietary pattern, which has been studied for over 70, 75 years, is associated with lower osteoporosis risk, lower hip fracture risk, but not just that, lower risk of diabetes, cardiovascular disease, obesity, cancer, death from cancer, all-cause mortality. The list just goes on and on in terms of the health benefits, decreased dementia risk, etc. That dietary pattern is a plant-forward diet. we know that a diet that is high in green leafy vegetables is associated with reduced osteoporosis and fracture risk. The Mediterranean diet is high in those, and high in whole foods. It emphasizes whole grains, nuts, and seeds. It emphasizes lean proteins like chicken and fish. And it de-emphasizes the red meat that is so popular in our culture. Red meat is used sparingly and in smaller quantities and less frequently than we consume it here in the United States. Packaged foods are eaten less frequently as well. And so that Mediterranean dietary pattern, and I've worked with thousands of patients and developed a system helping people transition into eating that way over time. When it becomes a habit, what happens is people's taste buds also begin to change. So those high fat, high sugary foods that they were craving before, they no longer do, and they actually don't taste as good when you start eating those rich, whole flavors from whole foods.
That is absolutely true. I ate the standard American diet 20 plus years ago. And truly, honestly, that food just does not taste good to me anymore. So I'm an N of one, but my thousands of clients, your thousands of clients, we're all in the same boat. So it is possible for sure. I'm curious.
If I can add one more thing though about
Please,
diet.
yes.
Even with the Mediterranean dietary pattern, even with how popular keto high protein diets are, what I find repeatedly, even when my patients are coming to me and they're saying I'm eating a great diet, and they are eating lots of whole foods and fruits and vegetables, people are not getting enough protein to maintain muscle mass and bone. The amount of
Yes.
protein somebody eats can account for 2 to 4% of bone mineral density. In fact, there are over 200 proteins in bone. It's not just the minerals in bone. There's a bunch of other stuff there. And there are a lot of proteins. The US RDA for protein, that's the minimum amount to prevent a deficiency. That is insufficient as people age to maintain muscle mass, which will help maintain balance and reduce the risk of falling, but also to maintain bone. You need higher amounts of protein than the US RDA. And so that's a big area. Even when I see people saying, I'm doing everything right, I'm doing all this stuff, and their bone density is not going up, and I do an intake with them, one of the common missing components is they're not getting enough protein.
Really great. Do you have a number of grams per pound of body weight or a servings per meal, or do you just encourage them to increase it? How do you tackle that one?
So what I like to quantify it. I know, calculations are tough for people. This is the only calculation I really have people make. And it's just to get a baseline. So the goal is to develop an intuitive sense of how to eat this way, but it's not intuitive for people initially. So I like to quantify it. So the recommendation is about 1.3 to 1.45 grams per kilogram body weight per day. So grams of protein per kilogram body weight per day. But in the US, we don't use kilograms. So that's about, if you take your weight in pounds and multiply it by 0.65, that's the number of grams approximately of protein you should be consuming a day. And then what I want people to do is not change their diet at all for a couple of days and just track what they're eating and get an understanding, where are you now versus where you need to get. And the other component I have them track, the only other thing that I focus on is plants. It's really simple, plants and protein. And I want people through this in my book as well, because the plants not only have the micronutrients, the vitamins, the minerals, the other plant nutrients that our body needs to thrive, but it's also rich in dietary fiber. And that fiber helps move the microbiome into a healthy direction. It eliminates waste. It helps regulate blood sugar. And so I have people shoot for 30 grams of total dietary fiber a day, because it's found in those whole foods as well. And so just plants and protein. People focus on that. It's not more complicated than that.
I absolutely love it. You are speaking the language, and I know lots of listeners are nodding along with you. So that's great. Plants and protein, a variety and abundance of plants, protein primarily focused on those lean proteins, the chicken and the fish and the turkey and things like that. I'm wondering, I know we can't minimize a food to it's this nutrient that's bad or anything like that. That's too simplistic. But is the reason red meat is adversely indicated for bone health, is that because of the acidic properties, or do you have any other hypothesis?
So it's difficult to know. There are a lot of byproducts that come out of red meat. I mean, there are
Yeah.
hormones in beef, just like there are hormones in dairy. All animal products have hormones in them.
Yeah.
There are metabolic products that can be created, like TMAO,
Mm-hmm.
from the breakdown of red meat in our bodies. Then there's how the red meat is cooked, and is it charred or not. So
Yeah.
it's a complicated, picture.
Yeah.
um, I don't have a definitive answer. All we
Yeah.
know is that there is a strong association between increased red meat consumption and increased cardiovascular disease risk. And what we know is that those are rich in omega-6 fatty acids. If you're going to eat beef, I do recommend it's organic, pasture raised, pasture finished. So those are higher in omega-3 fatty acids. I'm not against eating meat. I
Yeah.
eat meat, but maybe I eat it once a week.
Yeah. I am right in line with that. The TMAO is always a little bit of a hiccup because fish is also TMAO producing, and we could argue that
Right.
yeah, it's slightly
Well, the research
different
is not really
for
clear on that. I mentioned that because it's just not. I don't. I would say that here's I guess my bottom line. We can really get into the weeds about the biochemistry of things, but the reality is that the people don't behave based on biochemistry. The behaviors are based on dietary patterns and whole foods.
yes.
I'm not looking at a piece of meat and thinking TMAO. I'm looking at a piece of meat and thinking, wow, that really looks good, and that's high in protein.
Yep.
So if we can just substitute that with other forms of protein that are associated and known to be healthier, but are also
Yes.
delicious and can be prepared in a way that are satisfying, and it enriches the experience of eating. Because I do believe eating should be fun and pleasurable and a joy.
Yes. I am 100% in alignment with that. And I think the one time a month grass-fed filet that I eat or that you eat or someone else is eating is very different from where most Americans get their red meat, unfortunately, which is a fast food burger or something like that. And so it's really difficult to pick apart the exact mechanism. Just like you said,
And
I
also
agree with,
the quantity. So
yeah,
a quantity of a serving size of protein from meat, beef or chicken, is about the size of a deck of cards that can fit in your palm of your hand. And most people are
yes,
eating double or triple that in one
yeah,
setting. So it's not just the
yes,
frequency, but it's the quantity that's
yes.
also an issue.
I completely agree. So you mentioned something about leafy greens, which had my ears perk up because I always tell people leafy greens are a wonderful source of calcium. And I've actually told people I'm not the hugest fan of calcium supplements. I know you are, and you have a very specific research backed reason, and you have a very specific format of calcium supplements. So I'd love to just talk a little bit about this. My perspective is coming from some larger meta analyses that show that calcium supplements don't really prevent fractures. So I'd love to hear your take on that and how we can improve it.
Right. So first of all, the US RDA for calcium is about 1,200 milligrams per day in adult women. The average American diet is for women in the US is about 800 milligrams. So
Mm.
in order to get to that minimum 1,200 milligrams, or that dose, or that amount of 1,200 milligrams, supplementing with about 400 milligrams for most people, for the average person, is indicated and is sufficient to get them in there. There's no indication that going beyond 1,200 milligrams is better for bones. Now,
Okay.
that said, I'm also a believer of using dietary supplements exactly as the FDA intended, and that is as a supplement to a healthy diet, not in place of a diet. If people can get it all from calcium, then, or from food, then great. But most people, frankly, aren't. our lives are hectic, they're stressful, it's grab and go, it's convenient food, and frankly, just most people aren't in the United States getting that from food.
Yeah.
The current recommendations from the Bone Health and Osteoporosis Foundation and the American College for Preventive Cardiology is that calcium supplementation calcium is safe up to the tolerable limit or the safety limit set by the National Academies of Medicine, which is a total amount of calcium of 2,000 to 2,500 milligrams per day.
Okay.
Therefore, based on that, taking some calcium as a dietary supplement, as long as you're below that, is considered safe. There are studies that have shown in men up to 1,000 milligrams per day is safe. There are studies in women showing that there is no association with cardiovascular disease outcomes or all-cause mortality. There's a Women Health Initiative prospective study that was done by taking calcium supplements. Many of these studies that are currently going on or have been published are observational studies. They're not clinical trials, they're not controlled studies, which can overestimate the amount of calcium, can have co-founders and all of that. I am all for continuing to look at research as it emerges and making sure that we are doing things correctly. But right now, the research shows and the position statements show that supplementing with calcium is important for many people and is safe.
Okay. So if I'm understanding you correctly, that 1,200 milligrams per day, that's super important for your bone health. And as long as we're not going to 2,000 to 2,500 milligrams, you feel there's no risk in terms of artery calcification or any other kind of heart disease risk. And maybe this could be one more thing people track just for a few days to see what they're normally getting. If they're already getting, let's call it 1,500 milligrams, maybe no need to supplement. But if they're at that 800, which is the average, we do need a supplement. Am I summarizing it okay?
Yeah, that for people who are not getting that amount, supplementing with some calcium is appropriate. I do also think it's similar with protein. If you're not, it can be hard. For example, my requirement for protein based on my body weight is about 90 grams per day. I have a hard time getting that much with diet. So I supplement. I supplement with a protein drink. I have a pea protein powder that I like that I also take occasionally to boost that. Again, as the FDA intended, to supplement a healthy diet, not replace it.
Yeah, got it. Do you feel the same about some studies showing links between calcium supplements and dementia? And I'll be the first to admit that those studies were done on women who have had strokes already, so maybe not a representative sample, but you feel fine about that risk?
So there are also studies showing that calcium supplements have no risk for increased dementia. So either way, there are studies on both sides of the fence, and I believe it's too premature to jump on the bandwagon one way, or to jump on the bandwagon and summarily dismiss this nutrient that has been around for decades as a supplement that has been shown in prospective studies to be safe, and that has been shown in prospective studies as well, clinical trials, to maintain strong bones and reduce fractures.
Yeah, really interesting. So let's say someone out there is like, "Oh, I'm trying to increase my leafy green vegetables, but right now I'm probably more like standard American diet. So I'm convinced I probably do need a calcium supplement." I am highly confident that there's a spectrum of less good quality to very good quality on the market. Can you tell us what people would look for and what's important as they're choosing a supplement?
Sure. So I would say, and I have a blog on this, how to get your money's worth or how to choose a dietary supplement. How do you know what the quality is? And so when you're looking at, there are a couple of things. One, you can look at absorption, and that's important. Some types of minerals bound. So a mineral like calcium or magnesium or copper, they're not isolated in themselves. They're bound to a carrier. So in the example of calcium, there's calcium carbonate, which is most people probably know about. There's calcium citrate, which is another form, and they're not all as easily digested and absorbed. Calcium citrate, calcium carbonate, for example, requires stomach acid. So as we get older, there's a greater risk for us having lower stomach acid. And if you have an autoimmune disease, then that also can reduce your stomach acid production to make it harder to digest and absorb the calcium from calcium carbonate. And that's what can cause the side effects like constipation and abdominal cramping when you're not absorbing the minerals. And so calcium citrate is my preferred form because it doesn't require stomach acid. It's actually absorbed in the small intestines where it's a basic pH. And so you get a superior absorption with that nutrient. And then there are other forms as well. People have heard of coral calcium, and they've heard of MCHC maybe, and all sorts of different types of calcium. And that's all great. When I'm talking about the absorption, that's what's called bioavailability. That's a laboratory study. That's the same as saying your bone density goes up. It's a number on a test. The most important question I teach people when it comes to bone health and looking at bone health nutrients is to ask the fundamental question, has it been shown to maintain strong bones as indicated by fewer fractures in clinical trials? Now, that's not a treatment. The FDA is clear. Nutrients and dietary supplements are not approved to diagnose, treat, prevent, or cure any diseases. But there are lots of clinical trials and studies showing how powerfully certain nutrients can build bone by improving bone density, but most important, maintain strong bones. And the best indicator for bone strength is whether somebody breaks a bone. That's the ultimate indicator. So many companies out there will say, look at our product, look at our supplement, it improves bone density. Again, that's a number on a test.
Yeah.
When you look at all of the clinical trials on calcium and what's out there, there is no indication that one form of calcium is superior than another form at actually maintaining bone strength. So for me, it doesn't really matter which form of calcium people take. In fact, the majority of the research has been on calcium carbonate. When it comes to that, where the consideration is, though, I want to make sure people have the best absorption and experience with the calcium, that it has a very low risk for creating any side effects. And in fact, if they have oxalate kidney stones, it's the calcium citrate form of calcium that is recommended, not the calcium carbonate or any other form. And so for those reasons, that's the logic I use when I think about which form of calcium may be a better form for somebody.
That's great. Very understandable. And do you like cofactors along with calcium, or do you like pure calcium? What's your read of the research here?
So by cofactors, I'm assuming you're mentioning other vitamins and minerals along with it.
D, K, etc.
Right. So the question is, and I talk about this over and over in my book, I always come back to the most fundamental question. Has whatever we're recommending been shown to not only promote healthy bone density, but maintain strong bones as indicated by fewer fractures in clinical trials? There are only 4 nutrients that fill both of those requirements: calcium and vitamin D. And the research shows that calcium needs to be paired with healthy vitamin D levels in order to get the benefits of calcium. I believe that people should get their vitamin D tested. There's an association of reducing hip fractures. The maximum reduction of hip fractures with vitamin D is associated with vitamin D level between 30 to 44. So getting in that 30 to 44 range.
That's much lower than I would have expected.
For immune benefits, a lot of clinicians and the research suggest higher, 50 and above. But for bone health, that's what we're talking about. Most people want to go higher than that. I do. I keep mine around 60. And I test every once in a while. I supplement, especially in the winter. The other nutrient is MK4. which is a specific form of vitamin K2 in the dose of 45 milligrams per day. Now, vitamin K is a category of nutrients. So you talked about green leafy vegetables, and I mentioned it as well. Vitamin K1 or phyloquinone is what's found in green leafy vegetables. Vitamin K2 is another category of vitamin K molecules. And then within that category, there are different types of vitamin K2. What people will see in dietary supplements are MK4 and MK7. Those are two types of vitamin K2 available as dietary supplements. So again, the most important question is, not is one more better absorbed than another one, but have clinical trials shown that the nutrient in the dose that's in the product has been shown to promote healthy bone density and maintain strong bones as indicated by reducing fractures in clinical trials. The only form of vitamin K2 that fits that requirement is MK4 in the amount of 45 milligrams per day. There were over 7,000 volunteers in more than 25 clinical trials. It's been so well studied that it's been approved by the Ministry of Health in Japan since 1995 for bone health. And it's been shown in clinical trials to promote healthy bone density and maintain strong bones as indicated by over 70% fewer fractures in clinical trial volunteers.
Wow.
In contrast, MK7 has only been shown to slow down how fast somebody loses bone mineral density. And there are no studies showing that it actually maintains bones. There are no studies where the outcome was fractures using MK7 as the primary endpoint. So for those reasons, that's why when I was looking at this issue all the way back in 2006, 2007, and the research is there are decades worth of research on MK4. That's why I chose to formulate my products for my patients using MK4 in the clinical trial doses of 45 milligrams per day with calcium and vitamin D. There is one other nutrient that's been shown to fit those criteria that I talked about, and that's strontium. All of the clinical trials on strontium is a mineral, were done in Europe on a form of strontium called strontium ranelate. Strontium ranelate was approved in some European countries as a medication for osteoporosis. Of all of the clinical trials that have been done, it's been shown to improve bone density. There have been 6 large clinical trials on it. More importantly than bone density, only one of those clinical trials showed that it reduced hip fracture risk, which is the most dangerous type of fracture. The other studies showed that it only reduced vertebral fracture risk. But here's the problem I have with strontium. Strontium creates false bone density test results. It's a mineral like calcium, and so it incorporates into the bone. A bone density test is an X-ray. The X-ray goes through the bone, through the leg or the body, hits the bone and bounces off it. The angle at which it bounces off the mineral is detected by the machine. It goes through its mathematical magic and spits out the bone density test results. Strontium changes that angle, and the machine doesn't understand how to correct for it. It's not part of the algorithm. It's not part of the design of the setup. And so the bone density test results are inaccurate. Now, despite the limitations of the bone density test, I want them to be accurate.
Right.
More importantly than that, though, there are safety concerns with strontium. Strontium ranelate was removed from the market in Europe because what they discovered once it hit the market, looking at all this post-market data, is that for every one fracture that was prevented, it was causing a person to have a dangerous blood clot that can cause a heart attack, a pulmonary embolism, which is a blood clot in the lungs, or a stroke.
Yikes.
In the United States, strontium is only available as strontium citrate as a dietary supplement. There are no clinical trials, 0, on strontium citrate showing that it's effective or that it's safe. Now, it may be both, but there's just no data showing that. So that's for those reasons, I don't like strontium. So it's very clear. The other nutrients that we know are associated with bone health, magnesium, for example, magnesium has never been shown in any clinical trial to reduce fractures. And in fact, a study looked at the association of dietary magnesium and osteoporosis and fractures and showed no association. I'm a fan of magnesium. I love magnesium. Most people don't get enough. I think in a good multivitamin, getting some extra magnesium is great. But when I'm focused on bone health and what can I do to maximally and most powerfully promote somebody's bone health, I'm looking at those clinical trials, and that's how I've made my decisions. The other cofactors, boron, never been shown to reduce fractures. Also, typically in a good multivitamin, a little bit of boron's in them. So you can get those elsewhere.
Very interesting. I know the listeners are so appreciative that you have taken a hard look at all of this research and parsed it out for us. And so we're hinting around your supplement, but I would love for you to tell the listeners a little bit more about your product line, your book, how they can learn more about you and all the content you have to offer.
I started my company, NBI, stands for Nutritional Biochemistry Incorporated, in 2006 out of my medical clinic because I couldn't find the dose or combination of nutrients in existing products that were shown in clinical trials to work that I needed to help my patients. So I went out and I sought the solutions. I created the solution. Since then, I've never wavered from that quality and that emphasis on quality. And I've created products that have now been shipped to people in more than 15 countries around the world, helping them maintain and improve their health as well. So our products come with some amazing, never seen before guarantees in the industry because they're based on clinical trials and they have the dose of nutrients in the clinical trials and shown to work. And it's my passion. I mean, this was my passion project. I never thought, as I mentioned at the beginning of the interview, that, 15, 18 years later, I would be an expert in bone health and osteoporosis because I had a problem in my clinic with a patient and my mother-in-law that I was trying to solve. And I just kept diving deeper and deeper into this research and expanding as well ways that I could help people nutritionally. My book is there because it helps people walk through creating a holistic plan for themselves. I lecture at medical conferences. I do these interviews all the time. And what I've done is taken those almost 2 decades worth of research and put them into the book so people know what questions to ask their doctors to make sure they're getting the best recommendation and they can make the best decisions for their own health, but how they can also put a holistic plan together for their bones that makes sense for them.
That's amazing. I think everyone listening, if you're concerned about bone health, which you should be, should go out and grab a copy of the book. It's called Fracture Proof Your Bones, a comprehensive guide to osteoporosis. And I really love your emphasis on creating that bio-individual plan. That is the future of healthcare. So thank you for laying out a path for people to do that. We'll link to NBI's website. Oh, go ahead, please.
Thank you. I was just going to give that to you. I forgot to mention it before. nbihealth.com.
Yes, nbihealth.com. The supplements are available there. The book for sure we'll link to. Is there anything else we should mention before we tell our listeners goodbye for the day?
I think just fundamentally the most important thing when people get the diagnosis of osteoporosis is to take a deep breath and understand that it is serious, but it's not an emergency. There is time to educate yourself. There's time to learn and put a holistic plan together that makes sense for you.
That's so empowering. What a great way to close. Thank you again, Dr. John Neustadt, for coming on Wellness Your Way.